Welcome to the Smart Weight Loss Coaching Podcast. I'm Dr. Lisa Oldson, a board-certified weight loss medicine specialist and certified life coach. In this podcast, I'll share fresh insights and effective techniques for incorporating mindset, habit change, and proven science into your life. Are you ready to achieve sustainable weight loss, wellness, and longevity? Then let's jump in and lose weight the smart way. Welcome back. Today I'd like to do something a little different, kind of a rapid-fire medical news update. Because honestly, the last few months have been genuinely remarkable in the world of weight loss medications, and I don't want you to miss what's happening. Whether you're already on one of these medications, you've been thinking about them, or you're just curious about the science, today's episode is for you. We're going to cover three things: the brand new Zepbound KwikPen, the newly FDA-approved Wegovy HD at 7.2 milligrams, and the oral Wegovy pill. Let's get to it. First, let me just say this, because even though I say it all the time, it needs to be repeated. Excess weight is not a character flaw. It's not caused by a willpower deficit. It's a chronic medical condition driven by genetics, hormones, neurobiology, and our environment. And like any chronic medical condition, think high blood pressure, think high cholesterol or diabetes, it often responds best to medical treatment combined with lifestyle modification. Medication for excess weight isn't taking the easy way out, it's appropriate evidence-based care. Okay, now to the news. Our first topic is the Zepbound KwikPen. That is spelled KwikPen. If you're on Zepbound, which is also called tirzepatide, or if you're thinking about starting it, you now have a new delivery option, and it's a pretty good one. On February 23rd, 2026, the FDA approved a label expansion for Zepbound to include a 4-dose single patient use KwikPen, which is one device that delivers 4 weeks of treatment. So here's what that means practically. The Zepbound KwikPen holds all 4 of your weekly doses for the month. You use the same pen each week, attaching a new compatible needle each time. You don't need to draw up the medication. There's no separate syringe, and there's no measuring. For people who previously had to use the single-dose vials because their insurance didn't cover the auto-injector single-use pens, this is a significant upgrade in convenience and ease compared to the process of using a needle and syringe to draw up the medication every week. Now, what about cost? I know this is the part that's really important for a lot of you, as it would be for me too. Self-pay patients without any insurance coverage, as of right now, today when I looked it up, can access the self-pay pricing through Eli Lilly. It's called Lilly Direct. The cost is $299 per month for the 2.5 milligram dose, $399 for the 5 milligram dose, which is the second dose, and $449 per month for the 7.5 milligram, 10 milligram, 12.5 milligram, and the 15 milligram doses. That pricing is the same whether you're using the new KwikPen or the older syringe and vial method. So you get the more convenient KwikPen device at no extra cost. It sounds like I'm a commercial spokesperson for Eli Lilly, which I'm not. I just think this is a nice advantage. It's a nice new option. One important note, the $449 price reflects something called the Zepbound Journey program, and that rate applies as long as you refill your prescription within 45 days. If you go longer between refills, regular pricing will apply, which is really high. So keep that in mind as you're planning ahead for your refills. Now, I do want to be upfront with you. Medication pricing in this space moves fast. We're talking week over week, month over month changes. What I've shared is accurate as of the time of this recording in the spring of 2026, but I'd encourage you to go directly to the Eli Lilly website and search specifically for Zepbound cost savings to get the most current information before you fill your prescription, before you go to the pharmacy. I'll do my best to update you when things change significantly here. The KwikPen is now available through both your local pharmacy and Lilly Direct, which is a mail order free home delivery service. Or you can go online to enroll in the Lilly Savings Card program so that you can fill it at your local pharmacy at the same self-pay price. One other thing to note, the KwikPen requires separate pen needles, which I did not know the first week I started prescribing it. The specific KwikPen needles can either be prescribed separately or purchased over the counter. So be sure to ask your doctor about that when you get your prescription. As far as efficacy, how effective the Zepbound KwikPen is, this is the same tirzepatide, the same medicine, and it gives you the same results, which are generally great. It's simply another route we can use to deliver the same medicine. In the SURMOUNT-1 trial, people taking Zepbound 15 milligrams lost an average of nearly 21% of their body weight. In the SURMOUNT-5 study, Zepbound users lost on average 50 pounds compared to 33 pounds for those on injectable weekly Wegovy. This medication works well and will probably be the most potent medication we have available for weight loss until retatrutide hits the market, which is probably going to happen sometime next year. The KwikPen may make it easier for some people to take compared to the needle and syringe method, and since consistency matters enormously for long-term results, we want this to be as easy to take as possible. On to our second new medication option, Wegovy HD, which is the high new 7.2 milligram dose. This is the news that really got my attention. On March 29th, 2026, the FDA-approved Wegovy HD, a new higher dose of semaglutide at 7.2 milligrams, which is indicated for weight loss and long-term maintenance of weight loss in adults with excess weight. For context, the standard Wegovy dose that's been on the market had a highest dose of 2.4 milligrams up until March 2026. This new dose is 3 times higher, and the results reflect that. Just to review, because I know this can be confusing, Ozempic and Wegovy are the same medication, called semaglutide. We say semaglutide is the generic name, and Ozempic is the brand name when it's used for diabetes. Wegovy is the brand name when it's used for weight loss. Of course, this medicine isn't available in generic formulation at the pharmacy yet, so that's why we use the brand name. The maximum dose of Ozempic is currently 2.0 milligrams, and until recently, the maximum dose of Wegovy was 2.4. The STEP-UP clinical trial showed that once-weekly semaglutide at 7.2 milligrams delivers a mean weight loss of almost 21%. That's amazing. And nearly 1/3 of participants lost 25% or more of their body weight, results that start to approach what we've historically only seen with bariatric surgery. Wegovy HD can be used in adults who have already tolerated the 2.4 milligram dose for at least a month and only when additional weight reduction is clinically appropriate. That makes sense. This is definitely not a starter dose. Your doctor will determine whether stepping up from 2.4 milligrams to 7.2 milligrams makes sense for you. In my mind, it's a pretty big leap to go from 2.4 to 7.2 milligrams. So I'm planning to try it first only in people who need more weight loss than they can get on the 2.4 milligram dose and who don't have any gastrointestinal side effects. Not everyone can tolerate Wegovy, but some people feel absolutely fine on it without any side effects, and those people are the ideal folks to consider trying the Wegovy HD 7.2 milligram dose. By the way, Novo Nordisk expects to launch Wegovy HD in the US in a single-dose pen in April 2026. So it's coming very, very soon, and in fact might already be available by the time you're listening to this podcast episode. Now, I always want to be transparent with you about side effects because I think you deserve the full picture. So let's dig a bit deeper into the gastrointestinal side effects that I mentioned. The most common adverse reactions are nausea, vomiting, diarrhea, constipation, and abdominal pain, consistent with what we know about the GLP-1 class of medications in general. These effects are typically most prominent when the dose is being increased, and they usually improve over time, although some people don't tolerate the medication because the side effects never fully resolve. If you're trying semaglutide at any dose and you're having GI side effects, talk with your doctor because there are a lot of ways we can help you get past the side effects, though for some people it's a no-go. You can't spend the rest of your life feeling queasy or miserably bloated, so in that case, I'll usually try Zepbound or one of the older medications that doesn't cause much in the way of gastrointestinal side effects, although those older medications are not nearly as effective as the GLP-1s. There is one new issue at this higher dose that I want you to know about. Reports of altered skin sensation described as sensitivity, pain, or burning occurred more commonly at the 7.2 milligram dose than at lower doses, and generally resolved on their own or with dose reduction. Surprisingly, I've only seen this in one of my patients since I started prescribing the GLP-1 medications, and she had it at a dose lower than the new 7.2 milligram dose. The FDA is conducting further studies into this. In the clinical trial, dysesthesia, which is what we call this side effect, occurred in about 23% of patients at the higher dose compared to about 6% at the standard dose. It's not dangerous, but it's worth knowing about and discussing with your doctor if you're a candidate for the new higher dose Wegovy. Wegovy also carries a boxed warning regarding potential thyroid C cell tumors based on findings in rodent studies. It shouldn't be used in patients with a personal or family history of medullary thyroid carcinoma, which is pretty rare, not the most common kind of thyroid cancer, or multiple endocrine neoplasia syndrome type 2. Your prescribing doctor will screen for this before starting you on any semaglutide medication. The bottom line on Wegovy HD, for people who have done well on the 2.4 milligram dose but need more support to reach a clinically meaningful weight loss goal, this new higher dose may be a real option. It's one more tool in our toolbox, and that's always a good thing. Before we talk about our third topic, the Wegovy pill, let's hear a quick word from our sponsor. Just kidding. It's still me, Dr. Lisa Oldson, physician and founder of Smart Weight Loss Coaching. If you're as focused on your health as you are on the scale, you're my person. In my online program, we'll show you how to transform the way you approach weight loss so it takes up less brain space and frees up your time for the things you love to do. If you'd like to learn more about our women's or our men's program for weight loss, better health, and longevity, head over to smartweightlosscoaching.com. Join us to see how different a smart weight loss program can be. And we're back. We've already covered the Zepbound KwikPen and high-dose injectable Wegovy. Topic number 3 is the Wegovy pill, which can also be called oral semaglutide. Oral just means you take it by swallowing it. It's put in your mouth. And as you know, semaglutide is the generic term for Wegovy. I have been getting so many questions about this one, and I've already done one entire episode on it, which is episode number 138. But we'll quickly address it again here. The Wegovy pill was approved by the FDA on December 22nd, 2025, making it the first oral GLP-1 medication approved for weight loss in adults. And as of January 5th, 2026, it's now broadly available at pharmacies across the country. This is significant. For people who are needle averse, this opens a door that wasn't previously available. The pill contains the same active ingredient as Wegovy injectable, semaglutide, but it's taken once daily rather than once weekly. It also doesn't require refrigeration, which is nice to know, especially for people traveling or traveling to hot locations. Two practical advantages right there. There's one important thing to know about how to take it. The Wegovy pill must be taken first thing in the morning on an empty stomach with no more than 4 ounces of water. Then you need to wait at least 30 minutes before eating, drinking anything else, or taking other medications. It sounds like a small thing, but it does require building a consistent morning routine around it. One common question I hear is, what should I do if I'm already taking a thyroid medication, which also needs to be taken on an empty stomach, often an hour before eating? Of course, I'll let you talk with your doctor about this, but some people find that they prefer to eat dinner early, and they take their thyroid medication 3 hours after dinner before they go to bed. So how well does oral Wegovy work? In the OASIS 4 trial, people taking the highest dose of the Wegovy pill, which is 25 milligrams, achieved an average weight loss of about 17% if they stayed on treatment, compared to about 3% for placebo. That's meaningful real-world weight loss, but because the medication is so new, I think it remains to be seen how well people will tolerate that 25 milligram dose outside of research studies. Regarding cost, self-pay patients without insurance coverage can start at $149 per month for the 1.5 milligram starting dose. The two highest doses that you can eventually get to with oral Wegovy are 9 milligrams and 25 milligrams, and those are priced at $299 per month for self-pay patients paying out of pocket. For those with commercial insurance, co-pays might be as low as $25 per month, which is sometimes the same as injectable Wegovy and injectable Zepbound, of course, depending on your insurance coverage. Side effects for the Wegovy pill are similar to the injectable version and are primarily gastrointestinal related, meaning nausea, diarrhea, possibly vomiting, especially in those early weeks as your body adjusts. But some people are able to tolerate it well. We'll learn more as more people use this pill version of Wegovy, but so far the people I've started on it have had a lot of success. Of course, I know you want to hear if the pill is as effective as the injectable. Well, the pill leads to slightly lower average weight loss than the injectable Wegovy at 2.4 milligrams, roughly 14 to 17% versus the injectable's roughly 15 to 18%. Very close. But for many people, the trade-off of convenience and the potential to take a daily pill rather than injecting it is absolutely worth the very slight reduction in weight loss. This is a conversation to have with your doctor based on your individual goals, your lifestyle, and your preferences. Okay, time to put it all together. Here's what I want you to take away from all of this. We are living in a genuinely exciting moment in medicine when it comes to weight management. We now have more FDA-approved options than ever before, and many new ones on the horizon. We have different delivery methods, different dose levels, and different price points. Over 1 million patients accessed Lilly treatments through Lilly Direct in 2025 alone, and 1 in 3 new patients starting a branded weight management medication was prescribed a Zepbound self-pay option. People are getting access to treatment that was not available just a few years ago, and the future will be even brighter as more meds hit the market, and hopefully the prices continue to come down. No one should be paying more than $550 per month, which is a lot, for any of these weight loss medications. If you are, please go to the manufacturer's website to look for their cost savings options and coupons. So you can do that by going to Zepbound.com or Wegovy.com or looking up savings on Zepbound or savings on Wegovy. Before we wrap up, I want to underscore something critical. These medications don't work in isolation. They work best as part of a comprehensive approach that addresses nutrition, movement, sleep, stress, and mindset work. Medication will quiet the hormonal noise that drives hunger and weight regain, but you still need to build the life you want to live inside of that quieter space. That's not done through 5 or 10 minutes of counseling on healthy eating when you get your prescription. We know that people do the best when they have regular check-ins, ideally once a week in the first several months, and then eventually you could drop down to once a month when you're in your groove, losing weight and reaching maintenance. Habit change is hard, but with the right coaching and the support of medication, you can do hard things and create the lifestyle that you know will support your health and your weight for the long term. Between today's episode and all of our episodes where we talk about meds, you're now armed to have an idea about which option, if any, fits your medical history, your goals, and your budget before you meet with your doctor. Remember, taking meds for this is not cheating, and it's not taking the easy way out. I can't say that enough. You still need to do the hard work of creating healthy habits and potentially extinguishing older, less helpful ones. Of course, I would be honored to help you with that inside the Smart Weight Loss Coaching Program. Until next week, take good care of yourself because your health is worth the effort. Thanks so much for listening. If you'd like more support during your smart weight loss journey, check out our group coaching program at smartweightlosscoaching.com. Until next time, stay well and stay smart.